Welcome to Health IQ. I'm Dr. Alan Siegel. Tonight we have two special guests, Dr. Tiffany Werbin-Silver, she's an OB-GYN, and Dr. Lauren Adler, she's a pediatrician. They both are at Westchester Health Associates. Welcome, doctors.
Thank you. Thanks.
How are you? So, together as OB-GYN and a pediatrician, the relationship is a very important one in our medical world. Tell us a little bit about, I'll start with you, Dr. Silver. Tell me about the importance of working closely with a pediatrician as you're bringing one of your patients through their first or second child.
Well, Lauren and I work together at Westchester Health, and our relationship starts not only when I deliver children, but actually prenatally when we counsel our patients together in bringing a baby into the world and preparing for a baby to come into this world, and counseling our patients as far as what to expect when a baby is born. So our relationship begins even before a child is born, helping women navigate through pregnancy, through their whole delivery process, and then into the world of a neonate and through childhood, and circling back into adolescence. And then once they reach adolescence, they come back into the world of GYN, and hopefully as they grow through into the world of obstetrics again when they're ready to have children.
So it's a full circle of life, so to speak.
Yeah.
And as a pediatrician, how important is it to meet that mother and meet that person before actually the baby is actually born?
I think it's really important, particularly for new parents who are, worried about what to expect when their baby comes, to know that they've met the person who's going to be taking care of their baby when he or she is born, answer any questions that they might be having before the delivery, and to start that relationship, right away while the baby's still in utero, because it's going to be, we see babies until they're 21 years old.
Yeah, because sometimes the questions the mothers have, they tend to be more concerned about the baby than themselves, and then have that fine line between answering questions as a pediatrician, as an obstetrics specialist, and saying, well, the baby's fine, we need to take care of you right now, and then make sure everyone's focused on their health.
So often with a new mom, I have to tell them, the baby's fine, you need to take care of yourself. Moms are so worried about breastfeeding and doing the right thing. They're exhausted, they're not drinking, they're not eating, so really making sure that both patients are taken care of well is important.
And both specialties are obviously so important, with our families and taking care of everyone that means so much to us, our wives, our children. But there's also a lot of new concerns out there, things that we haven't been focused on in the past. Zika virus being one of those things, and there's a lot of questions about it and how it may be transmitted or how it may be passed on to a baby. And although we haven't had a lot of cases here in Westchester and the United States, you're probably getting a lot of these questions in your practices. So, Dr. Silver, why don't you give us a little bit about that?
We get a lot of those questions now about Zika in terms of, in the last couple of months, it's been about travel since all of this came out, especially since it was May of last year when this all came out with the first case in Brazil. And since that time, we've had a lot of questions from patients about where can they travel to, and that area of travel has expanded not only from Brazil through South and Central America and Africa and all those areas, but now people are concerned because not only has it been about traveling to those areas, it's also been about those who have traveled and come home, and not only being transmitted through mosquitoes, but transmitted through sexual contact with people who have traveled to those places and exposure to the virus through that. So there has been a lot to learn, and everything that has happened has come to us at a very exponential rate. Every day we get new updates.
New information.
Now,
is this a new virus, Dr. Adler? Is this something that's been around, or we just haven't heard about it in all these years?
We just haven't heard about it in all these years. It was first discovered in the early 1900s. Actually, they were doing research on rhesus monkeys, and they found a febrile rhesus monkey that had Zika. And then the first human case was in 1952, and it was mostly in Africa and not really in the Americas. And then in 2014, it was first discovered in Chile and has spread since then.
So as part of your standard of care, are we having to test for this, or is it just if symptoms arise that you think there may be an indication, or is it something where people just want to get tested for just to make sure that they don't have, when they're pregnant?
As far as current recommendations right now.
Yeah, current standard of care. What, you know, and
Standard
it's
of
kind of
care-
changing probably weekly at this point.
Right,
because-
and every day it sort of
Yeah.
changes. So really, if there has been exposure, and actually as current as this past Tuesday, I got an email saying that every pregnant woman should be asked at every visit, at every obviously obstetrical visit, about their possibility for exposure to Zika, meaning that every time they come in, and sometimes towards the end of pregnancy, you're coming in weekly, they should be asked about possible exposure to Zika, meaning have they traveled, have they been exposed to people who have traveled, you know, primarily through sexual contact, to the possibility of having been infected. And currently, right now, that would involve testing, and really the Department of Health is running those tests. So it's not like I can run the test from my office right now. You would have to send them to a hospital or send the samples to the hospital that would run that test, and it is, you know, backlogged in terms of the amount of testing that is being done, because there are a lot of people who have had that kind of exposure, who have known people who have traveled or who've been intimate with people who have traveled. And it used to be, as you know, recent as last week, that those people were their spouses, and it was thought that it was just the males who were transmitting that sexually. And now, as recent as this week, it is now thought that females can pass that on as well. So female to female relations, male to female, male to male, all of that is a possibility.
It's all a possibility.
Yeah.
And have there been diagnosed cases where it has transmitted to a child in utero?
Not in New York, but
Yeah.
other areas.
Right. In the country, in the
country.
United States?
Mm-hmm.
Okay, so that
Yeah.
has been already documented. So these are, you know, cases of concern and things that we should be looking out for.
Right,
So-
and there is no data to support that women who are pregnant are at higher risk for that transmission, but it has been proven, basically from whatever documentation that we have from these pregnancies and these exposures in other countries, that it can occur at any point in pregnancy. So it's not just limited to a particular trimester, it can happen at any point in pregnancy.
The transmission from
Yeah,
mom to baby.
exactly.
And so treatment-wise, if there is a woman who is pregnant and she does test positive, but maybe can you test the baby at the same time, or you could test both, right? So
Yeah.
Right.
And then can you treat?
Unfortunately, there is no treatment. So what that would involve is, you know, basically testing to see if there is true exposure. You know, you can test the fetus, you can test the amniotic fluid, you can test parts of the placenta and all of that. And then if you have a true exposure, what you would do, and what it is considered a standard of care, as you mentioned, is to watch with serial sonograms and watch the growth of the baby. And particularly what you're looking for when you are monitoring somebody with an exposure to Zika and a proven exposure is to look for documentation of what people know or associate Zika exposure in pregnancy with, or the small brains, or what we term microcephaly. And so it's not only associated with microcephaly or small brains, but also calcifications in the brain, eye abnormalities. It's associated with the biggest risk factor is really demise or death of a fetus.
Yeah, so these can be very serious events.
Yeah.
And as a pediatrician, obviously, if you know this were to occur in New York, you know, this would make a more obviously a difficult case from start, and that's not what we're looking for the families and for the children, of course. So, people do have to understand where they travel is important. Understand that there is you know, exposure out there. Obviously, there's still certain parts of the world that are more, you know, cold hotbeds for the virus at this point. And if there is travel to and from Brazil, I think that, you know, there should be, you know, definitely some caution for those families, especially if they're looking to, you know, have children or already are in the phase of having children. So, and you mentioned the sonograms. I know there's been a lot of great technology changes in sonograms, and sometimes they look like movies practically. They're so real, right? So how important is the technology, and do you follow along with the sonograms and get all the information if you're following that child during the
So if there was a mom who was exposed, they would follow the baby while the baby was in utero with serial sonograms. When the baby's born, the most important thing is, you know, finding out what the exposure's been. We can test the babies again through like blood tests and urine tests, and then really just monitoring the baby, measuring the head for microcephaly. We could do what's called a head ultrasound, where they actually use the ultrasound machine through the fontanelle in the head and see if there's any calcifications. having the baby see an ophthalmologist, checking the hearing, and just following that baby's neurodevelopmental progress as they get older.
Right, because the virus essentially, from what I understand, is it's not leaving the body; it's staying with you, right? So in terms of treatment, there's no antibiotic treatment.
There's no antibiotic treatment,
right.
But like other viruses, you get over the infection, you clear the virus.
You can clear the virus.
But for a fetus that was infected, the neurodevelopmental problems, can persist.
Right. Okay.
So.
Now, you probably get a lot of questions also for what are the worst things I could do for my child, while I'm having the pregnancy and during
right.
So what other things we know smoking's bad, we know drinking's bad. What are some other things that people may not think are so bad, but maybe are bad, and things that people should avoid?
I think using common sense, obviously, no drugs, no alcohol, no smoking, eating healthy, getting your fruits and your vegetables, and taking your prenatal vitamin is important.
Right. And different prenatal vitamins. There's been some not controversy, but you do need to be aware of what brands you're taking, what types you're taking, what the source of where they're coming from, because if you get poor, quality vitamins, or just like taking poor quality food, and sometimes there can be things in there that shouldn't be there.
Vitamins in general are not regulated by the FDA, so it is important to make sure you're getting your vitamins from a reputable source. Are there specific vitamins you recommend?
I think whatever is tolerable and coming from a reliable source is usually what I recommend. I think most important in the vitamins is the folic acid content, because of everything that's in a vitamin, really what we know has been proven is the folic acid prenatally, or preconception, I should say, because that's what we know will prevent neural tube defects or spinal cord problems in a baby. So if you can get on a prenatal vitamin prior to conceiving, at least 3 months, we know that is what study proving going to help prevent the spinal cord problems that we look for.
So even preventively starting to take vitamins even before pregnancy.
Absolutely.
So a lot of people may not think of those. A lot of times people don't even know that they're trying, or maybe
exactly,
or maybe they don't even realize that they're already pregnant, and maybe they've still continued some habits. But typically speaking, that's a question that comes up, like, I've been drinking, I've been doing that. I'm like, is everything okay in the first trimester? The first few weeks, I don't, it's not that it's good, but it's not that it's terribly bad, depending on the extent of
right, exactly.
Yeah. Yeah, do you agree?
Everything, everything in moderation,
I think we've always been, we've all had those stories where everyone's like, we didn't know. What about exercise and fitness, for both, the baby and, are there studies that have shown, healthy mom, healthy baby, obviously, that makes sense, but, to the point where proper exercise, diabetes issues can cause problems, poor eating habits, it affects both the baby and the mom. So what are the important aspects there?
I think exercise is always important, and exercise in pregnancy is important as well. I think it used to be that they didn't recommend you got your heart rate above a certain amount, but now you can. Is that right?
And I think that anything that you are usually adjusted to and normally used to is you can continue to do, and is perfectly acceptable continue to do. If you're not a marathon runner, once you get pregnant, it's not time to start training for a marathon. That's not the time to get all in shape and whatnot. But I think if you're accustomed to doing something, you can continue to do it as long as you are comfortable. And any time that you're not, or you feel like it's too much, that's the time to back down. But if you're usually get on the bike and you do a certain amount, you can continue to do that as long as you're feeling okay about it. But at some point, you're going to start to get a bigger belly, and at some point, your heart rate is going to get too high, and you're not going to feel so comfortable doing it, and your body's going to tell you, I need to back down, and I need to slow down. And you don't need someone to tell you to do that. You're going to feel it on your own, and you're going to want to do that. So I think it's perfectly acceptable. I think there are always going to be exceptions, and you should always, before starting anything new or feeling different about your exercise routine, talk to your doctor about it and see whether it's acceptable or whether you should modify your exercise course. So it's not a general blanket statement, but I do think that diet and exercise are always important, and you should continue to do it. And that's sort of my motto.
Even after the baby's born, you should continue to do it, because I strongly believe in what you model for your children is what they learn to do. And so a happy, healthy family starts with mom and dad, eating healthy, exercising, showing their kids.
And what about some of the myths and the legends of playing music to the baby and then the baby becoming, like, how do you feel about those things?
I think why not? You know what? They can hear in utero. Certainly it's not going to harm them if you're not blasting music into the belly, but I think it helps. And I think it helps mom and dad, too, to feel bonded to the baby and feel like they're already starting to do something parental. I think that's important.
Let me not attend rock concerts.
Exactly.
No Coldplay concerts for the...
So as a pediatrician, I do have to ask this question because it's always a hot topic, right? So vaccinations at an early age and studies, nothing's really been so overly conclusive showing that it causes autism or other types of learning disabilities. What is your overall opinion on it, and is it based on like the mercury or things that are what's going on in the industry at this point?
I mean, as a pediatrician and as a mom, I full-heartedly, strongly believe in vaccines. All the scientific evidence that I've read, all the studies I've read, really support the use of vaccines in terms of their safety and their efficacy. I know that there's a lot of information out there on the internet. You can read almost anything. But I think really getting your information from your doctor is the most important thing, and not necessarily believing just what you read. The studies show that, again, the vaccines are safe. I vaccinated my kids according to the same schedule I want to vaccinate my patients' children with.
But has there been a trend to spread out some of the vaccinations so they're not as
not in the medical field at all. No, exactly. And I have some concern about lots of people who want to come in and space out the vaccines. We'll work with them. We'll do that. But really, the schedule that I recommend is the schedule that's been studied and we know is safe and efficacious. And to use the vaccines in another way to space them out might not be as efficacious, because we know that if you give them at a certain time, you build your immunity and you boost it. If you spread them out, you might not get that. And
you feel like maybe we're more knowledgeable on learning disabilities now. We're more knowledgeable about what some of these executive function disorders, autism, spectrum, all these things. We just know more than we did 20, 30 years ago. Because,
we definitely know more.
As a child, I don't know what I had, but they didn't tell me. So
exactly. I think we're more apt to diagnose things. I think we expect more educationally from our children now than maybe we did years ago. And I also think that there's a lot of other environmental things that are different that could be causing some of the increase in diagnosis.
I'm glad you bring that up, because that's actually a good point. Environmental triggers for both a pregnant mom and a young child. There are a lot of environmental exposures, and whether the vaccination thing is a trigger, which we don't believe it is. Look, there's lead in the water.
Correct.
There's toxicity that we put on our grass, and they spray stuff all over the place. You're in front of electromagnetic computers all day. So, do you have any comments on exposure or exposures to pregnant women? Obviously, all these things should be of concern if you live in certain areas.
The same questions that Dr. Adler gets, I get as well. And so, I get the same questions in terms of what are you going to recommend? Because I do bring it up at the visits as well in terms of let's start thinking about what you're going to do in the hospital. You're going to get offered to do the vaccinations in the delivery room. At the time of delivery, you get offered to do your first hepatitis vaccine. Everybody state mandated has to get a vitamin K shot for their babies and some ointment in the eyes. So I do bring it up, and it always initiates a conversation about vaccines, in addition to all the other sources, like you mentioned, all the environmental stuff. And it's interesting, especially here in Westchester, where I feel like there is, a large percentage of autism and a large diagnosis or a larger than other areas, diagnosis of developmental disabilities or delays and autism. And it strikes a whole other discussion, I would say, in terms of, is that related to the environment? Is that related to what we're doing? Is that related to vaccines? And it's hard to say. I, like Lauren, I do believe in vaccines. I vaccinated my children according to the regular schedule. I don't know. Is it whether that we are more learned? Do we actually know more than we did way back when? Is it related to the vaccines? I'm not sure.
And there may also be socioeconomic issues where obviously Westchester being a middle upper income area, we have access to professionals like yourselves and other types of professionals that study learning disabilities, and so there's this kind of push to kind of get everyone's kid checked out kind of early to make sure that things are what they should be, and there's, I guess, like they call it the spectrum, so it's like it's all over where they fall on that line, and I guess if you really want to put everyone on that line, you almost could to some degree. So now what about like something silly as like well water? Like, is well water a concern? Because there are a lot of homes that have well water, and should water be tested in the home, especially when somebody's pregnant? Is there a concern besides because they don't get the water reports from the town if they have their own water?
I mean, you should get your water tested, and there's the whole issue with lead and getting the lead testing.
And then there's a lot of underground oil tanks in Westchester, which do leak, and they can leak into wells, and so there are issues along those lines. So I think the environmental factors are important. I think the cleaner the better for everyone, and as best, especially more so maybe when you're pregnant and you have to worry about not only yourself but the child. So and what about like new techniques or technologies coming out in your practice? Is anything new and exciting for either one of you? I know medicine is always changing, especially when I bring on all the orthopedic guys. So any new diagnostics, the ultrasounds you're getting?
Oh, they're getting phenomenal. You can practically see your child before it's born, which is so exciting.
A 3D imprint on your wall.
I thought was so cool actually was recently somebody brought in, and it may not be as new as I think, since my youngest is 4 years old, but they bring in tape recordings so that you can tape record the heartbeat of your baby from your sonogram, and then you put it inside a bear. I thought it was a neat idea.
I like that. That's great.
Right.
And then you put it inside a bear as a gift
to the baby.
To the baby, a little older.
Nice.
Yeah,
so
it's just it's a nice little exactly. It's not technology, but fun little gift.
But something interesting new that I'm actually looking into is, and I don't know that much about it yet, I'm just learning about it, is genetic testing for psychiatric medications. So there's a genetic test that you can do
to see if they have an adverse reaction
to see what medication will help them. Like in terms of kids with ADD, it's a lot of trial and error. What medication's going to work at what dose?
Interesting.
And there are specific
I've heard of this
genes.
myself a little bit. Yes, so they can actually do a pretest to see what may because some they may not react well to, some they wouldn't.
Exactly. So some medications at a specific dose will be beneficial, and that at a different dose will give you an adverse reaction, or some groups of medications are not going to work for you at all because of the specific genetic receptors that you have.
Right. Well, you mentioned genetics. I mean, obviously, it's a big part of what you guys are looking at when you're coming through the pregnancy and looking at the family history and the tests that women usually have to go through. There's a lot of not controversy, but okay, what ages does everyone need an amnio? Should we do an amnio? There's another test you have to remind me that they do earlier than an amnio, the CVS, right? So
chorionic villus sampling.
So and then which one's safer? Which one should you recommend? Do you have any
and then there's a whole
comments?
slew of non-invasive pregnancy tests that people are doing now, and people.
So how do you feel about because I know my kid's head would not stop moving with the amnios. He couldn't
Don't
stop
poke an
jumping.
eye.
He still can't jump, so he's still jumping. But
That's so funny.
That's okay.
Well, I think everything has come a long way, and to do all these non-invasive testing at an earlier time, even than the chorionic villus sampling, is fabulous. Just because you can get with more sensitivity and specificity and better, better clarity in terms of finding out the more frequent genetic abnormalities, meaning things like trisomy 21, which is commonly known as Down syndrome, or other more common disorders like trisomy 18 and 13, which are also as common, not as common, but more frequent, like Down syndrome, in addition to the 2 sex chromosomes. So everybody kind of wants to know about it to find out the gender, but in addition to the gender, there's some very vital information in there. So you can find out those 3 chromosomal abnormalities in addition to the gender. And so all of that can happen at a time that's earlier than both the CVS and the amniocentesis, which is a little bit later on in pregnancy. So having those non-invasive pregnancy tests, or NIPTs, has really remarkably changed our genetic testing and counseling for patients.
So is it still recommended to do those procedures, or are you?
We are. It depends. So these non-invasive pregnancy tests are really done for women who are going to be what we call advanced maternal age at the time of delivery, so over the age of 35, or if something else triggers the need to do that kind of testing. So something is off on a sonogram, or as something about their history is provoking it.
There's an age that you kind of gauge.
Yeah,
any other history.
Exactly.
Okay.
And you could do it pretty early. The problem is sometimes you don't get enough. It's basically testing fetal cells and maternal blood. So you could do it pretty early. Sometimes you don't get sufficient cells. So we typically run it.
It's a scary thing for parents to start learning all these things, and people that I personally went through this, and my daughter had transreciprocal relocation, and I was just like, what?
Wow, yeah.
I'm like, what's that? So without knowing the knowledge of it, and and then getting the facts and learning about exactly what it is and what the possibilities are or aren't, and the statistics are and aren't. It's frightening for parents and people that are, even myself being in the healthcare field. I'm like, I had no idea what they were talking about, so I was like, had to learn all about it. So but that's the beauty of having more than one doctor as a team, and kind of talking about things and looking at statistics and
you hear big scary words and you don't even know what does that equate to long term. What does it mean? How will that affect you, or how will that affect her? So
and then so tell us the best part about are you guys in the delivery room together? You get the call right after? Or
I love going to the nursery to see the babies. That's like the highlight of my day. The moms and the dads are so excited, and the babies are so they're so
and you'll do all the initial checks like after
we come in, we examine the baby, measure the head circumference, check them from head to toe, go to the mom's room, talk to the parents, exactly, tell them how the baby's doing, make sure that feeding's going well, baby's doing all the things that they're supposed to do, basically peeing and pooping and eating.
And then she gives the baby back.
And then she gives the baby back to mom and dad, exactly.
And it just and then the relationship just keeps going on and on, and keeps working together. So
we work together very closely.
Right. Well, that's nice that you guys have a professional relationship, and pediatrician and OBGYN working closely together. I mean, obviously between your two specialties, we can do another half-hour show with you, another half-hour show with you, but we only have one half hour tonight to share between the two of you. So I want to thank you both for coming on the show. And I think the main thing that we touched on earlier on with the Zika virus is obviously awareness, education, not panic. And just open communication with your doctors, letting them know possible exposures. Has there been any contact? Has anyone traveled? Are there any symptoms? And just be pragmatic about it and get a good night's sleep, and everyone should be okay, right? Exactly. So thanks again for coming on the show.
Thank you.
All right, thank you. I want to say thank you for watching. Dr. Alan Siegel, Health IQ, and we will see you at our next show. Thanks again. Bye-bye.